Stop taking supplements. So now that I have your attention, I'm not just kidding, maybe just a little bit, but I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner. I practice functional neurology. I treat chronic pain, chronic conditions, and I've done it for a long time. Been in practice for 40 years, and I mean, it is, my patients come in here with not only a laundry list of medications, but it is not uncommon several times a month for people to come in here who are taking 35 supplements multiple times a day, many of them, and are, from the functional neurology perspective, they're very stressed. That just seems to be part of chronic conditions, and having to take 35 supplements and figure out when to take one in the morning and then take it 2 hours away from your thyroid, and then take this one in the midday and this one at lunch and this one 30 minutes before bed, does seem to consistently contribute to their stress. So it's kind of an interesting presentation. It's something that I have a difficult time not smiling when the person's telling me this, because it's like so ridiculous. It's just crazy. I use supplements. I use a lot of supplements. I use herbs. I use botanicals. I use just about everything but homeopathic remedies, basically because you can't use them in the state where I am. I'm in Reno, Nevada, but they all have benefit, okay? We've done a presentation earlier on supplements, and we cited research on studies that have been done relative to the supplements themselves, what they contain, what they don't contain, relative to, some very, very well-known companies that sell supplements. And you can look that back up. I'm going to reference it again in a few minutes. But supplements are not regulated, okay? I mean, they're not regulated. That's a struggle for me. I'm not one for regulating supplements, for the record, okay? I go both ways, but you start going down that rabbit hole, and to me, bad things start to happen. Okay, but then that opens up supplementation to the wild west type of a situation where it's buyer beware, baby. It is, it's something that you really need to be attentive to. So let me speak from a practical and clinical perspective here. I do have patients come here. I do treat people with chronic conditions. I will tell you, in all seriousness, less is more for those types of conditions. The people come in here with autoimmunity, people come in here with chronic inflammation, something called microglial priming, which for those of you who have post-concussion syndrome is a big part of the reason you still have it. It's chronic inflammation that won't go away. Those of you who come in here with Crohn's disease or celiac or Hashimoto's or immune system conditions where your immune system can flare up. If you're taking 35 supplements in a day, they are contributing to your exacerbating your problem. I will guarantee you, without a doubt, they are contributing to your problem. I've patients who walk out of here. We might use several supplements along the way, and we might get up to where we use 8 or 9 or 10 supplements to get rid of something like a SIBO, small intestinal bacterial growth. But then once it's better, we can withdraw the symptoms and move on to the next thing we do, because less is more when you have chronic inflammatory and neurological responses. So I'm not saying no supplements are good, okay? When I'm saying stop your supplements, really I'm kind of saying stop and think about this, okay? Because there's so many parameters. Let's just to supplementation. When I started getting into this, and I remember that the teacher who was teaching the course, my mentor, a gentleman named Dr. Datis Karazian, he said, to do this, you're going to have to know, your physiology. You're going to have to know what all the organs do. You're going to have to do autoimmunity. And I'm like, oh, that's a piece of cake. And they said, you have to know all the supplements. You're going to have to know all the herbs and all the botanicals and what they do and which ones work for what doesn't, how much to give them. I was like, whoa. And it took me a couple of years to really get a grip on managing supplementation. there's definitely an art to it. But you want to step back, take a step back, and say, what does the patient even need? So let's just start with let's start with supplementation, and let's start with the pitfalls of why you might consider looking at your supplementation with a much more critical eye. First of all, it's like I said before, there was a study out there, and I don't want to mention too many names because I don't remember all the names of the companies. I do remember Target was one. I was blown away that GNC is one, which is those of you may know, it's a national supplement company. And there were several other ones. There was 3 other ones. And it was a government study. They took the 5 top supplements that people use, and they checked these 5 industries for it. And we have a reference, more specific reference to this in another video that you could look up. And it was stunning. It was like the top supplement across the board, 40% of the supplements in those 5 places had not 1 grain of what the herb or botanical that it stated on the bottle was in it. It didn't have it in there. There was none of it in there. And then there was all kinds of variations on that. It was the next variations were, there was just a teeny little bit in there. Maybe there was 1 or 2% in there. The other variations were that the quality wasn't there. The other variations were there's contamination. The other variations were there are fillers that I can't use for my patients because most of my patients have autoimmunity. And so you have to be very careful about the supplement in and of itself. I have an entire wall of supplements out front, okay, and adjacent to our waiting room, and they're quality supplements. I mean, it took several years to really research these supplement companies and go to seminars and find out who are the credible ones, which ones worked for my patient population, which ones were best for my particular patient population. Not all people are built the same. Not all people's physiology is built the same. So I don't mind, telling you, like some of the people I use Apex. I get nothing for saying this. I use Zymogen, I use Biotics, I use Thorne, I use Designs for Health. These are reputable companies. And here's what you're going to say. Some people are going to be out there and go, man, those are expensive supplements. That's because even though the supplement industry is not regulated, there are states who do regulate them. And a lot of the states that these are in, some of them in California. I mean, to make a supplement in California, it has got to be just pristine. It has to have in there what it says, and it has to have the amount in there what it says. It has to be done in a facility that is you can eat off the floors, and so it costs more to produce those types. And a lot of them are small companies, and so you need to understand that the quality of the supplement matters, and it may be better to take a few of a more expensive supplement that actually works than take 35 supplements, not knowing whether they work or not, and spending all that money, and it's the old story. You're just either peeing it in the toilet or you're throwing your money away. So there's that. Okay, there is and then there is what supplement do you actually need? The supplement industry certainly is not regulated, so marketing is like it's out there. Now it's even CBD oil. Okay, I'm listening to that online now, and I get CBD oil is anti-inflammatory, and I get it helps a lot of people for anxiety, and it can help people with sleep, and it can help people with joint pain if you get a quality product. And because they're not regulated yet, I'm in Nevada, so we got like a CBD marijuana place on every corner, it seems like, dispensary, because it just went legal. But they can all make the claims, we're the best, we're the one, we're the greatest one. That'll change, but you don't know. You don't know, and then there's a lot of cowboyish type organizations out there that have bad stuff, and so it's there. You need to beware. Now what could be one of the ways you would beware? when a patient comes in here and they're taking, whether they're taking 8 supplements or whether they're taking 38 supplements, once I have looked at the patient's file and discussed things with them and are starting to think they may be a good candidate for what we do here, if I see that they have a high supplementation load, I'll, as a qualifier, I'll say, what about these supplements? I just take them because I've read a lot about them. And my next question is, do they help? If the answer is I don't know, they're not helping. Okay, and I'm telling you, please understand, I have no interest in. I don't sell, supplements to the public. I don't have interest in any of these companies, but I do treat people, and it's a problem if somebody comes in here and they're taking 35 supplements and they want me to treat them for an autoimmune problem, and I know those supplements are going to be screwing them up and they're not going to want to get off of them. I'm not going to take them as a patient. I literally will not take them as a patient, okay? Because and the litmus test is, if I don't know, it's not helping you, okay? I would at least want to hear, well, it makes me feel better or it makes me feel worse, okay? But if it doesn't make any change, it's maybe one of those supplements that has nothing in it, that it says it has it. I don't know. I don't know what all their 35 supplements, and I'm not familiar with the hundreds of companies, all the hundreds of companies out there. So I don't know the quality of all of those things. So a good litmus test is to isolate those supplements out and see how you feel. Do you feel better or worse? Now here's the next challenge, okay? And this is where I go back to saying it took me a year or two to figure out the supplements. It's the dosing. Now I'm working with quality products right from the beginning. So I didn't have the do these products work? Okay, these were quality products. Maybe you do have that confidence. Maybe you're working with a quality multi-level marketing group, because I must say most of those products are pretty quality stuff, although a lot of them aren't for my patients because they mix so many things in. This is another issue. You got autoimmunity, kind of simple supplements are a lot better for you. In other words, supplements that don't have 26 different ingredients in. But let's go back to, okay, now you're going back to try to figure out your supplements. So now you start taking, so let's say you're only taking 8 supplements. So you put 7 offline, or let's say you go, oh man, these 2 really make me feel better. So you keep those 2 because they really make you feel better. So I'm good with that. That's enough for me. They make me feel better. They're not making me sick. Keep taking those. Let's look at the other 6. Now you take 1, you take it on the dose it says on the bottle, and for a couple, for a week, and you go, wow, I don't feel any better. I don't feel any worse. Okay. Does that mean it's not helping you? Not necessarily, because the dose on the bottle is usually a minimum dose. One of the rules when I started years and years ago, I actually did a lot of nutrition. Back in my first several years in practice, like in the early 80s, was if somebody's sick, triple the dose on the bottle. Now I don't know if that's still a good rule, okay? So, and I don't use it for the record, but you may be underdosing. Okay, so when I'm treating here, and let's say I have somebody who has something called small intestinal bacterial overgrowth, okay, which was a bacterial overgrowth in your intestines, and it causes gas and bloating and a lot of bad things. All right, so we need to kill it with a natural antibiotic. So if I give them a certain natural antibiotic, maybe I'll use a Berberine. And lots of companies have. Maybe I'll use a Berberine, and a week or 2 later they still have gas bloating stuff. Now I increase the dose. Now they have it. Now I increase the dose again. And I go okay, now I've given them 3 a day and it's not working, and usually 3 a day works with that. Do I take that away and go, it's not working, or do I keep going? Well, what my observation has been for my product, for the dose of my product, which is very, very significant dose, that 3 usually works, but it doesn't necessarily mean I should take it away, so I might add something called Oregano. There is an art to this, and to have that art, you need to understand the supplements. You need to understand what they do. It's not like you just look online and somebody goes, okay, oregano is good for this. It kills everything. Berberine's good for this. It kills everything. It controls your diabetes. Yeah, but you need to understand, is it the right thing for you? Do you have the thing that it treats? And are you using the right amount, or should you be using a combination? Okay, so so nothing happens. You at least I will tell you this: why take it? Even if you're not taking it at the right, if you're not taking it at the right dose, you don't know that. You're taking it that dose, it's not working. It's not working. And so on down the line. And in our patients, when they take supplements, some of them I know across the board are going to help a certain amount of people. Some are going to be sensitive to that same supplement. So if they take it in an isolated fashion, they come back and they tell me, oh, we'll go back to the Berberine thing. Oh man, I got worse gas and bloating and all that. We stop that. Maybe we go to something like Oregano, or maybe we go to another garlic or something like that, or whatever, capsule or something along those lines. And all of a sudden you feel better. Okay, so I don't know about you, but for me, I'm trying to help to get people better, and it's a little bit of a tedious task to figure out which supplement, which kinds of supplements, what kind of dosing, and in the functional medicine world, I only want to use them until they help turn on and get the either get the problem better or get the physiology of that area. Well, I'll take CoQ10 for the rest of your life. Well, if you're taking a statin drug, that's fine. But for me, CoQ10 is something people don't need to do if their gut's good and if they're not stressed out of their mind and if they don't have any food sensitivities and so on and so forth. So if you need to keep taking that, you should start looking for other things, because those other things are going to be there. I guarantee you, there are certain things you shouldn't have to take for the rest of your life if your physiology is good, and so you have to try to figure that out. So when I say stop taking your supplements, I certainly mean stop, look around, stop and evaluate. Are they the first question is are they helping me? When patients come in and they say, what about the supplements? In an ideal scene, my world is like, stop all your supplements, because then I have a clean plate and I know what happens if I give somebody something and there's a reaction. I know it's that. I know it's not anything else. But if the person is taking certain supplements, I had one yesterday, and there's a young gal, and they're taking cranberry supplement, and it's her urinary tract infections. Okay, so I get that, and so I said, just keep taking that, because it's going to make her feel better, and frankly, we're going to get to the cause of what's causing her urinary tract infections, and she's eventually not going to need that. So I think more of it is just giving you a broader perspective on supplementation, because I don't know that that's really out there. Most of the sites online are certainly promoting a certain supplement. Some of them are promoting every supplement known to man. Here's magnesium. Here's the 500 things that magnesium do, and you should do it. Well, I've been testing people for magnesium forever, and there's not that many people that are magnesium deficient. Okay, but everybody's taking it, so you have it's just that you have a lot of that. Okay, I don't see much of how to take it. I say, it's this disease, and this disease works to that. Okay, fine, but how do you take it? And if it doesn't work, do you take more? And is it not working because you don't have enough hydrochloric acid in your stomach, and you're not breaking it down, and you're not absorbing it? One more aspect of supplementation right there. So, and probably the last aspect to kind of create that full picture for you. So this is supplementation. This is supplementation in its full. This is where I go between, do you regulate it, do you not? I don't think you regulate it, because if you regulate it, my experience is, and again, I'm not anti-medicine. Those of you who watched me over the years would know that I'm not anti-medicine, and particularly, but for chronic conditions, the medical field it's not there yet for them. And I still see studies that came out. I heard one popular health guru who does like a minute a day on this local radio station. I listen to it every day. And he came out with a study from somewhere that said there's no evidence that supplementation works, and so on and so on. Well, if it didn't work, my patients wouldn't be getting better, So it works, but unlike medication where there's strict regulation of the medication, and even that's not being followed. There you go. So unlike medication, you're really not given parameters. I mean, maybe you're given, take 1-2 times a day, take 2-3 times a day, but you're not told any of this. You're not told it might not work, or oh, if it's not working, it's, you just need to keep taking it because you're deficient or something like that. So I just felt like there was a need out there to present the basic overall parameters of supplementation, the considerations for you to try to figure out, am I spending like hundreds and hundreds and hundreds of dollars a month for nothing? Should I at least take the time to try to figure out which 3 of these are actually helping me and get rid of the other ones and spend my money on those? Should I seek help from somebody to at least figure out my supplementation for me so that I know what I'm doing or what I may need to do to eliminate some of it or to make it work better? I mean, it's really that involved. How do I know? Because it took me 2 or 3 years to really, 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 really feel good about the consults I was having with patients, so that I knew that they were getting a real value for the time that they were spending with me, because I was making better decisions on, yes, this is a supplement you should have. No, you should keep taking it. We need to increase the dose. We need to add this one. And it's a real art. It's a real art, and if there's any courses out there on it and you're into supplementation, you should probably take it. So so we tricked you a little bit with our stop your supplementation thing to get your attention, but we felt this is an important topic to kind of share with you from a perspective of not having any particular axe to grind, other than it's one of the more bigger challenges when people come in here. Sometimes I can't get them, they're like, I can't get them to go down off of their 30 supplements. I'm not going to be able to help them. That might sound very strange to some of you out there right now, but just think about that what I just said may be a legitimate piece of data that you need to know. All right. So thank you for listening. I hope you enjoyed this. If you have any questions or any ideas on things that you would like me to present in the future, please feel free to send them to me. I always like to do topics that people are interested in, and this one seemed to be a big one. Thank you.